And here I show you a case we did in 2011 as part of that study. You see a very difficult situation, not a lot of bone height available. The first premolar, still visible on the radiograph, has been removed. And there, of course, implant placement was not so difficult, but in the second premolar, the first molar site, the bone height is between 2.5 and 5 millimeters. So we did the surgery with a lateral window technique. We put in 2 implants, one in 14 and one in 15. And we did then a sinus flow elevation with a composite graft. That means autogenous bone chips mixed with DBBM, as a bovine bio-os. And you see the second implant had very low ISQ values, 46 and 39, which is far below any threshold. Of course, we did not intend to go for immediate loading here, so we did a submerged healing. So we put a membrane on top to keep the soft tissue cells off our bone regeneration area and went for a primary closure. 2 months later, we did an uncovering of both implants and moved on for a provisional restoration. And we were very astonished to see that our second implant in area 1.5 already improved tremendously from 46.39 to 63.71. Now we decided to go into restoration because we had 2 implants and we could splint them. And we did a provisional restoration, which were implant and tooth supported for another 4 months. And here now you see November 2011, then we opened up again and put in a third implant. So that was the implant in area 1.6. And that implant showed then an ISQ value of 67 and 61. And we let it heal. 5 weeks later, we already recalled the patient to see where we are, because he wanted to have a better provisional prosthetics for the Christmas party. You see that tooth number 17 has been removed then, and you see the ISQ is now 77. Look the quality of the healing. So everything is fine. So here you see the patient 2 years later, all 3 implants very well integrated, all restored with a single crown, and the ISQ has been extremely useful here to make always the necessary decisions when to move on.